Hello and welcome to Upstate CBD's Wellness Talks. So this time I'm going to be talking about CBD use in elderly customers, as well as mixing or not mixing, just information on prescription medicine. So there has been a stigma around the use of cannabis for many years, especially in those of the older generation. So, however, I, completely understand why, because propaganda and media tend to make cannabis seem like the devil's lettuce. You smoke it and you're gonna die, basically, or become this lusty broad, I don't know, whatever. Such an interesting idea to have of something. Well, within the arrival of CBD in retail stores, I've personally seen a wide demographic of customers coming into Upstate CBD and, looking to check out our products and ways of ingestion, and the bulk of them being elderly. So I thought that was pretty interesting to see, wanting to find out different routes on, pain relief, anti-anxiety, antidepressant, just a good quality of life in your older age. So although few older patients have been enrolled in cannabinoid studies, there have been some research to determine the efficacy of CBD for geriatric customers. A narrative literature review aims to provide a brief introduction for the geriatrician to the potential indications, evidence-based contraindications, which means if it has adverse effects, and side effects of medical cannabinoids in older people. So within this wide study that, it basically just looked up a ton of research studies and made a conglomerate of the benefits for older patients. So here are a few of them. It demonstrated a statistically significant improvement in average daily pain. It may have a role to play in reducing refractory chemotherapy-induced nausea. Cannabinoids reduced self-reported spasticity compared to the control, so that's for a stroke or neurodegenerative patient. Changes in weight gain and decreased agitation from the use of synthetic cannabis medication. It also may play a role in potential reducing of dementia-related behavioral problems. That's been a lot of people have come in here specific to their loved one developing dementia, and if CBD can help with neural-related agitation, behavior, slowing down the process. CBD administration was associated with diminished autonomic arousal, leading to a reduced anxiety state, and reported improvements in the major symptoms of Parkinson's disease. So as you see, there's a wide range of benefits and therapeutic effects that CBD offers to our elderly customers. So once again, it is really great to do your research on which products would work best. So, however, as we see in age, our livers and kidneys may be slower to eliminate drugs from the body. In addition, older patients and those with chronic health problems are more likely to be using multiple medications, so the risk for drug interaction increases. Drugs are metabolized and eliminated by enzymes in the liver, specifically the cytochrome P450 CYP family of enzymes. Of these, CYP3A4 is the most prevalent CYP enzyme in the liver and is the one responsible for metabolizing an estimated 50% of prescription medications used in clinical practice. It oxidizes small foreign organic molecules such as toxins or drugs so they can be removed from the body. So with CBD, it inhibits the CYP3A4 and CYP2D6 enzymes, which can increase levels of drugs metabolized by these isoenzymes. So CBD can increase the level in your blood of these drugs, as well as not fully metabolize them out of the body quick enough. So the interaction can cause either to inhibit the drug that you're taking and its effects, or potentially keep in abundance within your system so they're not being metabolized out and you're not getting rid of them, which could be really bad for somebody. As well as CBD increases the level in your blood of the blood thinner Coumadin. So Coumadin is basically what's in grapefruit that, they say do not take if you are on blood thinners, because that can lead to excess blood thinning and potentially a bleed out. So we need to be really careful about what drugs and prescription medicine we are on before taking CBD. So I usually tell people, talk to your physician, talk to your pharmacist beforehand, get all the ins and outs on how these are metabolized within your system, as well as, stay away from taking a CBD edible. So the sublingual method, which is the oil under the tongue, this allows CBD to completely bypass the liver metabolism. So the compounds can avoid being broken down by those enzymes, and it reaches the bloodstream more quickly. So CBD delivered sublingually showed significantly higher bioavailability than CBD delivered orally. So you might get better results from taking it sublingually because it goes right into your bloodstream, as well as it bypasses the metabolism, so you don't have to worry about using those enzymes to break it down and potentially having the drug interaction. So also, when CBD is applied topically to the skin, it never reaches the bloodstream or the digestive system, and it goes right into the surface and to interact with the nearest cannabinoid receptor. The very nature of skin is to block things from entering the body, but if CBD salves and lotions are applied heavily enough, they can permeate the skin through the pores and have a positive effect. So we usually tell people, if you are nervous about the prescription meds that you are on, start with a topical. If you have elbow, hip, knee, whatever pain, you rub that lotion on and it goes to the CB1 or CB2 receptor that is closest to that location. So you'll have the relief right in that area. So there are many options for the geriatric customer that we have here. And, we love seeing people of all ages come on in and get information and to just understand it a little bit better. So here is a lotion. It's Matrix. It is one of the best lotions that we have here. This one is 3,000 milligrams. It's about 3% total CBD per pump. So you should get about 1,000 pumps out of here. This stuff is strong, and it goes off of our shelves so quickly because this stuff works tremendously for people. Then there is also a local brand called Wellville Spa, based out of Boston Spa, and this is a broad spectrum tincture. So it is made with MCT oil, which is medium chain triglyceride oil. These are really great for the brain and neurodegenerative diseases because of the omega-3 and omega-6 fatty acids, as well as it is broad spectrum, so you don't have the 0.3% THC if that is something you are worried about taking. But broad spectrum is great because it has all of the other cannabinoids, plus the terpenes and the flavonoids and the other parts of the plant that are really essential for our body. So once again, I am Renata Filiacci. I am the holistic practitioner and manager at Upstate CBD, and we are all here and available to give you information whenever you need it. So go down to the website, it's right below me, www.upstatecbd.org. You can send me an email, once again, right below me, or you can give us a call at either numbers to talk to any of our employees to get the information that you need. Thanks for tuning in, and I'll see you next time.